Hello, welcome to another episode of the Question Bank. Today we have a pretty cool case. So today we have a 58-year-old woman who was brought to the operating room for a lumbar discectomy. Okay, she is induced with general anesthesia with propofol and rocuronium and is then intubated. Prior to incision, the patient's end tidal CO2 has decreased. Blood pressure is now 90 over 62 and heart rate is 116 beats per minute. Bilateral wheezing is noted on auscultation of the lungs as well, and the patient appears to be sedated and paralyzed. Which of the following is the next best step in management? Okay, so we have an acute case over here. So let's dissect this. We have a 58-year-old woman. She's in the operating room, so this is a scheduled surgery. It's not an emergency surgery, it's scheduled. She's going to have a lumbar discectomy. Okay? She is induced with general anesthesia, so she's gotten propofol and rocuronium. So this is important to keep in mind which drug she's been given. Okay? And is then intubated. Okay, so far so good. But now here we start. So just before the incision, so this is important, it's not to do with the surgery itself, it's prior to the actual surgical procedure. The patient's end tidal CO2 has decreased. Now what do we mean by this? Okay, so when a patient's intubated and they're connected to a ventilator, the optimal, okay, so let me just correct you on this. The sort of end tidal CO2, my pen's being all funny today. There we go. End tidal CO2, okay, should be maintained at between 35 to 45 millimeters per mercury. Okay, so that is the normal range at which you should be maintaining the end tidal CO2 when the patient's intubated and on a ventilator. Now we can see this patient's end tidal CO2 has decreased, which means in this patient it is less than 35. Okay, this is important because that means the patient's not ventilating adequately, which means there's going to be a big problem now. The blood pressure patient is hypotensive. Okay? Hypotensive. And the patient has a heart rate of 116 beats per minute, which means the patient is tachycardic. Okay? They've also given us another key bit of information. Okay? They've given us the fact that not only is it 90 over 62 and the heart rate is 116, we have a bilateral wheezing as well when auscultated. So bilateral wheezing is important to note, and we will see why. Okay, so we can see bilateral wheezing. What do we do now? If we connect 1, 2, 3, 4 symptoms, okay, what does this look like? Let's go through our options. Repositioning the endotracheal tube. So sometimes what can happen is the endotracheal tube can go further down than intended and can actually slide into one of the bronchioles, or the bronchi, sorry. So if we imagine the trachea coming down this way, if we have the tube coming down, and sometimes it can slide into one of these bronchi and can cause a unilateral obstruction. Okay, where you'd have unilateral wheezing. This patient has bilateral wheezing. So we can say that A won't be an option. B, administer bronchodilators and proceed with surgery. The patient is currently sedated and paralyzed and on a ventilator. Okay, with regards to administering albuterol, albuterol can help relieve any bronchospasms. Okay, but it does not improve hypotension. It does not improve tachycardia. Okay, and it won't address the underlying issue. And what is the underlying issue? With these 4 symptoms, we are thinking anaphylaxis. Okay, anaphylaxis is the culprit here, possibly due to one of the general anesthesia drugs. So, the correct option over here would be C, to C for any flushing. if we place the patient in reverse Trendelenburg position, this would mean that you're putting the head up and the legs down. This would decrease the venous return back to the heart and can actually increase the risk of cardiac arrest. Okay? This can increase the risk of cardiac arrest in anaphylaxis. So the correct answer is to examine the skin under the drapes to check for flushing, which is another sign of anaphylaxis. We've gone a little over time today, but I hope you've enjoyed the video, and stay tuned for more.